Okay, hi everyone, and thank you for joining us. My name is Molly Maher, and I'm the Deputy Director of Partnerships for the U.S. Health Division at Dimagi. I'm joined by my colleague, Elena Faust. In this webinar, we're going to describe how we have used flexible technology to respond to emerging public health needs and demonstrate our pro bono offering for monkeypox case management. Please pose any questions you have using chat throughout our presentation. We will be monitoring your questions and taking multiple breaks if any come up. Before covering our monkeypox solution, I'm going to introduce our company and context as a context for this work. Dimagi is a social enterprise with 20 years of experience supporting health technology. As an impact-first organization, we offer flexible technology solutions and services as a partner to the governments and organizations who use them. Dimagi has a long history and substantial presence in global health, with projects in more than 130 countries and national scale programs that have reached 1 million frontline community health workers. In collaboration with government and NGO partners, Dimagi supports efforts across public health continuums, notably including infectious disease response for Ebola and Zika. As COVID-19 entered the US, public health professionals were challenged to make technology systems meet a new type of need. They had to manage high case counts, change the data and information they were collecting and sharing regularly, and they had to do it all very quickly and with limited resources. In March of 2020, Dimagi was contacted by colleagues at the CDC and began rapid response efforts for COVID. Calling on knowledge gained in our past disease response work, leveraging our platform technology, and aligning with both the CDC and local public health responses, our team developed a template application for COVID case investigation and contact tracing that helped public health professionals meet that challenge. The solution was adopted by and continues to be used in several jurisdictions, with localization and deepened features for each partner. These jurisdictions are able to investigate cases, collect contacts, monitor symptoms, and offer health guidance to slow the spread and keep their communities safer. Our team has focused on this and grown in our response to the important needs in US public health, establishing a division focused on this work. In addition to our COVID-19 work, we have projects in other public health focus areas, research programs, and in behavioral health across a wide geography in the United States. The monkeypox solution we'll demonstrate today, as well as the COVID-19 solution just mentioned, are built on ComCare. ComCare is an open source platform developed and maintained by Dimagi. Offered as a SaaS hosted solution, ComCare is an interoperable, low-code application platform. This means apps made on ComCare have the feel of a custom solution, but leverage the power and efficiency of a platform with pre-built functionality. Specifically, ComCare offers a number of functions that support public health case management, like the monkeypox solution calls for. There are data collection and assignment workflows, role-based access and experience, and bidirectional SMS for monitoring and follow-up. Though able to scale to any number of conditions and program needs, ComCare is typically leveraged and used as an integrated complement to electronic disease surveillance systems for public health. By being a modular component, ComCare can enroll different types of users, such as a mass amount of temporary contact tracers, and allow for rapid and efficient response to emerging public health needs. When monkeypox cases began to grow in the US, our team recalled the value of early and rapid COVID-19 work and eagerly responded by creating a template application for monkeypox case management using ComCare. We had 3 aims when we were designing this template app project: that it be flexible, realistic, and accessible. To make it flexible, we've designed the user roles and data collection to reflect a potential range of department staff size and practices. We also limited some of the automation that is often a benefit of ComCare as a way to not alienate variation in local practices. Instead, we're presenting recommendations and workflow guidance in the solution. To make it realistic, our fields reflect CDC reporting and guidelines. We also appropriately scoped features to level of complexity required by the current count of cases, making it more digestible for rapid training and adoption. It's also offered as a linked project space, meaning our team can push solution updates that reflect new public health practices if they become available. Lastly, to make it accessible, we moved quickly and are offering this free of charge to public health departments. The solution includes 6 key functional areas for case management: case investigation, contact tracing, assignments for staff, symptom monitoring, vaccine or other intervention tracking, and reporting. We've developed 4 template user types, which reflect our experience across jurisdictions for COVID-19, with supervisor and staff roles for both case investigation and contact tracing. Knowing teams have different internal structures and vary in size, these roles can be overlapped. So if a county, say, has 2 staff members doing it all, they can be assigned all of these roles and see all of the pieces of functionality they need to do their jobs. I'll now pass it over to Elena, who will give us a demonstration of this application.
Thanks, Molly. I'll go ahead and share my screen. And Molly, can you just confirm that you're seeing CommCare?
I'm not seeing your screen right now. That looks great, thank you.
Okay, perfect. So as Molly mentioned, we do have a few out-of-the-box user types included in this solution. And this demonstration is going to follow 2 different user types as they complete some of their daily tasks in the system. The first is a supervisor user who is responsible for registering new cases in the system and assigning cases and contacts to individual staff members for further follow-up. The second user type is one of those staff members who is responsible for calling individual cases and contacts and checking in on contacts daily. So I'm first going to log in as Sarah. Sarah is our supervisor user, and I'll access the application. And so I'm first brought to my home screen, and you'll notice on my home screen that it's tailored to the types of activities that I need to do the most throughout my day. So my screen here shows me lists of cases and contacts that need to be assigned out to staff members, as well as other tools associated with assignment, such as bulk assignment. So I've just received a positive lab result from a lab that is within my jurisdiction, and I want to register this case in CommCare so that my staff can follow up with this person. If I had several cases that came in all in one day, I could upload them into the system in bulk. But since I just have one case coming in today, it's quicker for me to go ahead and register that case manually in the system. Before I do that, I'm going to come to search cases, and I'm going to verify that there isn't already an existing record in the system for this individual. So you'll notice here on the search screen, I can search based on a combination of a number of different data points. I'm going to use first name, last name, and date of birth today. And I did want to mention that CommCare can be configured to include relatively robust deduplication workflows, but we're not going to be showing those in the demonstration today. So if there were any results returned for the search criteria that I entered, they would appear in a list here. Since the list is currently empty, I'm going to register a new case for this individual. And here on the case registration form, I will enter a couple of key pieces of information about this individual. And you'll notice there are a couple of required fields here at the top denoted with a red asterisk. These are required because they are data points required by the CDC to report a monkeypox case. I will indicate this is a confirmed case because we do have the positive lab result on file. And then I can enter some additional information about this individual, such as the language that they speak and the phone number where they can be reached. I could enter more demographic information here if I would like. I will go ahead and put in the date of birth. And then I'll go ahead and submit to register this case. I did want to note, if I wanted to include a free text note for the case investigator, I could do that here. And if I wanted to actually enter that lab data that I received for this individual, I would check this checkbox and I would be brought directly to the screen where I could do that. For now, I'm just going to submit to register this case. This creates a new case record for Brandon in our system. The next thing that I want to do today is assign cases out to individual staff members so that they can receive a phone call today. And before I do that, I want to get a sense of which staff members in my jurisdiction may have the bandwidth to take on some additional work today. So to figure out which staff member to assign to, I'll come to the data summary. And the data summary provides me a really quick at-a-glance information about a few key data points in the system, such as the total number of cases and contacts in my jurisdiction. And it also provides me with a list of how many cases and contacts each individual staff member on my team is currently responsible for. So in this way, I can see who might have some extra bandwidth today to take on some more phone calls. Once I have a sense of which staff member I would like to assign to, I'll come back to my home screen. And if I had several cases that I wanted to assign and I needed to get it done very quickly, I could do that using the bulk assignment tool. Since my jurisdiction has pretty low case counts right now, I prefer to just go through and assign out one at a time. So to do that, I'll come here to my unassigned cases list. This shows me a list of every case in my jurisdiction that isn't currently assigned to a specific staff member. And we can see this includes Brandon, who I just registered. So let's get Brandon assigned out to a staff member. Here at the top of my case assignment form, I can see a couple of pieces of read-only data that facilitate the assignment. I can double check that this case does have a phone number so the investigator will know which number to call. And I can also double check the language that this case speaks and make sure I'm assigning him to a staff member that is able to communicate with him. So let's assign Brandon to Mandy for additional follow-up. At this stage, I would likely continue through this list. You'll notice Brandon has fallen off now that he has his assignment completed. So I would continue through this list and get all of my cases assigned to staff members. But for the purposes of the demonstration, I'm going to change my login. And I'm going to log in as Mandy, who is the staff member that we just assigned Brandon to. And we'll take a look at the system from Mandy's perspective. So here on the home screen, you may notice that it looks a little bit different from the supervisor's home screen. Again, the home screens are tailored by the user role. So here I have access to lists of cases and contacts that I'm responsible for reaching out to today. That can serve as my task list as I work through my day. So the first thing that I want to do today is check in on any new cases that have been assigned to me that haven't yet had their interview completed. And I'm going to do that in the My Cases Require Investigation queue. This is a list of all of the cases I'm responsible for that I haven't yet had the opportunity to interview. So for example, you'll notice Aurora here. I did previously reach out to her and leave her a voicemail, but I haven't been able to conduct her interview successfully yet. You'll also notice Brandon appears here, the case who was just assigned to me. I haven't yet tried to reach out to him at all, so I'll go ahead and give him a phone call now. I'm going to record the information about our phone conversation using the case investigation form. This form is based heavily on the CDC's short case reporting form, and the majority of the data points gathered here can be reported to the CDC via the Decipher database. So once again, at the top of the form, I have some read-only data to help me conduct my interview. For example, I can see the phone number that I need to call to reach Brandon. If I wanted to record a free text note in Brandon's file, I could do that here and just jot down any information about our conversation that I would like. Otherwise, when he answers the phone, I will indicate that he is providing this information on behalf of himself today. And I'll run through the demographic and contact information that we have on file with Brandon and confirm that it's still accurate and up to date. I can also document additional information that Brandon shares with me, for example, his address, as well as information about his sex, his gender, and his race and ethnicity as well. So on this form, I also could record vaccination details for Brandon if he has received a vaccine. I could also view any lab result data that was on file for Brandon if any had been recorded. But the most important thing I want to do is ask Brandon how he's feeling and see what symptoms he may be experiencing. So Brandon shares with me that he's experiencing both a fever and a rash, so I'll indicate that here. And then those just began in the last couple of days. So I'll note his symptom onset date as well as his rash onset date and where on his body this rash appears. I also have the ability here, if I need to document any pre-existing conditions Brandon may have that might put him at higher risk of developing severe illness, such as his HIV status and if he has any other immunocompromising conditions. Also on this form, if I need to, I can record information about how Brandon may have been exposed to the virus, including any recent sexual partners, as well as any recent travel in the past couple of weeks, whether that's domestic or international. Assuming that I don't have any travel events to record for Brandon, I'm going to wrap up his interview. I'll note that I was able to reach him and he agreed to speak with me today and that his interview has been completed. And the next thing I want to do is speak with Brandon about his close contacts. So I'll indicate that I would like to move on to contact registration. And here on the top of the contact registration screen, you'll notice we do provide some guidance from the World Health Organization about what constitutes a close contact. This is something that we often do in CommCare is embed public health guidance directly in the system. We found that this was really helpful, especially during COVID-19 response when there were very large workforces and public health protocols were changing very rapidly. Rather than needing to research externally, folks could see what the latest guidance was right within the system. So I can register as many contacts on this form at one time as I would like, but for now I'll just register one. And speaking with Brandon, he lets me know that he has recently been in contact with a friend named Carlos just yesterday. And once again, Molly mentioned we really made a concerted effort to limit the number of required fields within the system so that jurisdictions have the maximum amount of flexibility to determine which data points are critical for their team to record. However, there are a couple of required fields that remain in the system, for example, last exposure date here. The reason for this is that the last exposure date drives downstream logic in the system, including calculating how many days remain in the contact's 21-day monitoring period. So I'll record a couple other pieces of information about this contact, including the language that he speaks and the phone number where he can be reached. And you'll notice I could record a bit more data here if Brandon is able to provide it to me, but it's not required. And I'll submit the form to register this contact. What this does is creates a new contact record in our system, which will fall to the queue of unassigned contacts for a supervisor to assign out for further follow-up. The next thing that I want to do today, or the next task on my list, is checking in on any contacts that I'm currently responsible for monitoring. So to do that, I'll come to the My Contacts Require Follow-Up queue. This queue provides me with a list of every single contact that's assigned to me that requires a phone call from me today. So there are a few different reasons why a contact might appear in this queue. You'll notice, for example, Netta has not yet had an initial interview completed. So today I'll give Netta a phone call and I'll conduct an interview quite similar to the one that I just conducted with Brandon. You'll notice we also have contacts in here that are enrolled in daily phone monitoring, such as Ricky at the bottom. This means I've already conducted Ricky's initial interview, and I've enrolled him to receive a phone call from me each day, checking in to see if he's developed any new symptoms. Once I give him his daily phone call, he will drop off my list. So my goal for the day is to get through all of the individuals on this list and have the list be empty by the end of my workday. Finally, we also have contacts in this list that are enrolled in daily monitoring via SMS, such as Brent here. Daily SMS monitoring is a feature that really saves me a lot of time because the contacts that I enroll to receive SMS will get an SMS message each day asking them if they've developed any new symptoms. And assuming that they haven't developed any new symptoms, they don't need any help, and they do continue to respond, I won't need to spend time giving them a phone call every day. So it's easier for the patient, for the contact to just respond to a quick SMS. It's easier for me to have fewer contacts to call. However, if they do need help, if they start feeling sick, if they request assistance via SMS, or they just fail to respond, they will show up in my queue here to make sure that they don't get missed, and I do give them a call. So I'm going to actually reach out to Brent. And before I pick up the phone and call him, I want to understand why he's in my queue today and what I can help him with. So I'll come to the contact monitoring form. And here on this form, I can drill down and find out the specific reason why he appears here. So the system is letting me know that Brent reported symptoms via his SMS survey yesterday. And so I'm going to go ahead and I'm going to give Brent a call. I'm going to ask him how he's feeling, and then I'll provide him some information about how to get tested and how to isolate from friends and family. So to do that, I'll record a new follow-up attempt. And if he picks up the phone, I'll indicate that the attempt was successful. I can also write any notes I would like about the conversation. Maybe I'd like to note in the record that I spoke with Brent and provided information about testing centers near him. And I'm going to go ahead and ask Brent, what are the symptoms that he started experiencing that caused him to report symptoms on his survey? So he lets me know that yesterday he noticed a rash developing as well as enlarged lymph nodes, and I'll indicate that here. And I can also just record that those happened yesterday. We can indicate where on Brent's body this rash is appearing. And the system here is providing me some tailored guidance and instructions based on the data that I've input. So because Brent is experiencing symptoms, the system is suggesting to me that I need to speak with him about testing as well as isolation practices. If he were asymptomatic, I would receive different tailored guidance here, reminding me to give Brent instructions about how to continue to monitor symptoms daily. Also, because he is experiencing symptoms, the system is prompting me to convert Brent from a contact into a case. So I do want to do that. And this will allow him to be followed up with by our case investigation team. The last thing I'm going to do here is unenroll him in daily monitoring, since he'll now be followed up with as a case. And I'm going to go ahead and submit. This will bring me straight to the screen where I can convert his record from a contact record into a case. And I'll indicate this is a probable case because it's not yet confirmed by a lab result. When I submit this form, this will create a case record for Brent, which will be displayed to a supervisor so that they can assign Brent to a case investigator to have his interview completed. This concludes our demonstration, and I will hand the presentation back off to Molly.
Thank you so much, Elena, for that demonstration. I'm going to take a moment to answer a couple of questions before moving on. So we received a couple directly and have one open. The first question is, how long would it take to get this up and running? So the template application is ready to go out of the box and it's available today. It requires a very limited amount of setup from our team, which can be done in a matter of days. Written training materials, a non-production environment, and support for getting on board into the system is available. A small amount of admin time from a user might be needed to provision users, to get training and set up on your end, but we can support you in understanding that scope. When we wrap up, I'll put our contact information up and you can feel free to reach out to elaborate on that information. The next question is, can we extract the data? Can we perform summary analysis too with the tool? So definitely CommCare allows for extraction of all data. And even though this is offered as a pro bono solution, as with all of our work, data is owned by our partners and will be retained by partners for use. You can extract using Excel and then import it into any business intelligence tool that you like, or conduct some analysis within Excel. There are some reports that you can build on CommCare. We did not pre-build special reports views on summary analysis, but the extract is configured in a way that can help support reporting to the US CDC for case reporting requirements. And the last question, is this a completely different solution from the COVID one? Why could someone use both? So both the monkeypox and COVID-19 solutions are built on CommCare. So they do have some similarities in their purpose, but we did make a totally new offering for monkeypox in order to tailor it both to the content and the complexity of this condition versus COVID-19. Because CommCare is so configurable and flexible, and it does allow for rapid adjustment using that low-code application builder, we often do see partners expand their use of CommCare to meet additional needs as they come up. Multiple of our US partners are using CommCare for COVID-19 and now other use cases such as behavioral health, STI tracking. So a single subscription does allow you to add applications, and users can have familiarity with the system from previous work that translates over. So there's a benefit of economies of scale for expanding out into other use cases. I think that's all of our questions at this time. So let me share again. I'd like to just call out our current status and some opportunities for next steps. This template was launched earlier this month. It's available for immediate use, as I mentioned. Though we note some daily case counts in our areas have stabilized, we know there are real gaps in information and that some communities continue to be disproportionately affected by the continued spread of monkeypox. We do have a few partners actively evaluating and adopting this template, and we're really eager to share it with any others who can make use of it to better serve their communities. You can connect with us at our email here. Okay, this concludes our webinar. Thank you so much for joining us, and feel free to reach out for more information. Thank you.